Hello, I'm Dr. Elizabeth Tansey, co-director of the Washington Institute of Dermatologic Laser Surgery. Our site is involved in clinical studies to evaluate the Zeltiq procedure for the non-invasive reduction of fat in areas such as love handles and back fat in properly selected patients. I am also a member of the Zeltiq medical providers of the Zeltiq procedure, serving a savvy patient base, we seek to manage the entire patient experience, which begins with the handling of the initial phone call by my office staff or a sit-down consultation with my nurse or nurse practitioner, and continues through the treatment session and the follow-up visit. From the very beginning of this process, we find it's important for the patient to understand whether they are good candidates for the procedure, what the procedure can and cannot do in terms of efficacy expectations. Photographer take before photos of the patient, focusing on the body area or areas to be treated at the very beginning of the. Next, I mark the patient, indicating the targeted treatment areas. This is also a time when caliper measurements of the fat layer thickness in the areas to be treated takes place. Here, I carefully apply the Zeltiq gel pad and vacuum applicator to the targeted area, again mentioning that the specially designed applicator cup uses a gentle vacuum pressure to draw tissue between the cooling plates. I advise the patient that he or she may feel a pulling sensation caused by the vacuum pressure, and that there may be some temporary redness or mild bruising from this pressure after the procedure, which typically resolves within the treatment area during most of the procedure. Patients are quite comfortable during the procedure. Just before the cycle is complete, my pager sends me an alert. I then return to the patient as soon as possible. Once I arrive in the treatment room, I remove the applicator and assess the treated tissue. It's very helpful to show the patient how their skin looks post-procedure to assure them that the skin is intact, that any initial redness is mild, and any other effects are slight and temporary. From a clinical viewpoint, by assessing the treated tissue in a timely manner, I can see where to place the applicator for the take-home guidelines with the patient and give them a copy to take with them. This is also the time I like to remind my patient about the importance of maintaining healthy eating and exercise habits at home. Also, we strongly encourage the patient to schedule a follow-up visit in 2 to 3 months before he or she leaves the office that day. We generally introduce the possibility of an additional procedure at this time. During the follow-up visit, we may also talk